by extending my gratitude, I would like to now begin the session by seeking the blessings of Lord Dhanvantari. Namami Dhanvantarimadhidevam Surasurairvanditapadapatmam Loke Jararubhayamrityunasham Dataramisham Vividhaushadhina. Now, I would like to introduce today's expert, Dr. K.V. Rajagopalan sir, who is going to share his views on the topic preventive cardiology. Sir is currently the Chief Medical Officer and Deputy Superintendent of Arya Vaidhyashala Kottakkal. He completed his BMS under the Gurukula system of education from the Coimbatore Ayurveda College in 1990 and has a expanding career of 31 years, where he has worked as the Chief Medical Officer currently and also been part of the publication division in the Arya Vaidhyashala. He is also the RAV institutional guru under Kaya Chikitsa. He has conducted various public awareness programs on Ayurveda. He is a member of team with WHO, where Arya Vaidhyashala is doing a collaborative research project on intervertebral disc prolapse. He has also participated in various national and international seminars and is taking lectures in various platforms in the at the international level. With these few words and without further delay, I would like to welcome sir to start today's sessions.
Thank you, Dr. Pooja. I think I'm audible to you and the screen is seen.
Yes, sir.
Okay. Respected Vaidya Padma Bhushan Devendra Tigunaji, Dr. Vandana Sirohaji, Director of RAV, and Dr. P.M. Varya sir, Chief Physician of Arya Vaidhyashala, my respected Guruji and my dear Shishyas. So today the topic given to me for presentation is preventive cardiology in Ayurveda. So we know that we are living in an era where the heart is
moved from the donor's body, quickly connected to the device
either through
through
the
the
air or
aorta.
ambulance from one place to another or one person to another. We are living in an era where one person is living with the heartbeat of another person. We are living in an era where one person's death is giving rise to another person. So while appreciating all the advancement, all the technical advancement in the modern science, all the advancement in the modern surgical procedures, modern interventions, one question is lacking. Where do we stand now? The number of coronary artery disease, the number of heart replacement, the number of angioplasties, valve replacement, pacemaker fittings, and myocardial infarction, everything is increasing on the other end, while we are saying that we are advanced that much. We know that is why what we have to understand is we have lost our control over our heart. That is the final word. We are losing our over our heart. So WHO says coronary artery disease is number one killer amongst all the other diseases. And if you see the list of lifestyle diseases, the heart diseases becomes number one among the topmost diseases. So when we say about lifestyle diseases, there is no other better science than Ayurveda, which can contribute a lot, which can give that much of medical assistance to people who are suffering with lifestyle diseases. In that way, Ayurveda have got a lot of things to do in the heart diseases. So what is our aim in doing heart diseases? One thing is we can prevent heart in getting into such a serious situation, whether it be myocardial infarction or anything. And second thing is we can improve the quality of the heart. And third thing is we can improve the functionality of the heart in harmony with the other organs. That's also very, very important. And nowadays, or even olden days, we can say, we thought that cholesterol is the main culprit for creating all these coronary heart disease. When we say about cholesterol, we have to think that statin, most of the people are taking statin in different brands. And we had one patient who had been using statin since last 5 6 years. And he came here with neuropathy, walking imbalance, and unsteadiness while walking. With all the conventional treatments, what we did not get that expected result of that patient. So we told that patient to consult their cardiologist to regulate the dose of statin what she is taking, because we know that statin could be one of the reasons for neuropathy. Even if you search the Google, we can see that there is a terminology called statin-induced myopathy, statin-induced neuropathy, so many things. So in such a way, we told that patient to consult that doctor to regulate the dose of statin. As such, the doctor was kind enough to reduce the dose of statin, and ultimately what happened? She started walking in better way. And this gave her more confidence. And after that, she herself stopped all the medicines. And after stopping those medicines, what the miracle happened is that patient could stand and walk very easily. So this is an indication how much trouble the other medicine. I am not blaming any other system, but how much trouble the other systems are giving with the name of preventive cardiology or cardiac protection. And now, even modern doctors admit that cholesterol is not only factor for creating coronary artery disease. There are so many other factors also. We know that according to Ayurveda, stress could be one of the main factors for this coronary artery disease. See, there would not be any other science which has got so much importance, so much correlation with the heart and brain, or heart and manas. Hridayam Chetana Sthanam. These are certain things which we know. Still, to refresh our mind, I'm just telling you all these things. And Buddhir Nivasam Hridaya Pradoshya. That is, Hridaya is supposed to be the stand place for making the Buddhi or Manas. So like that, so many quotations we can see. So why I am telling you all these things is, even a treatment for the Manas can also give better results for the heart. And according to certain people, we can say that it is got Asraya and Asrayi Bandha. Heart and Manas are Asraya and Asrayi. And when we say, some acharyas, Sushruta says us, Manas is the Prabhava of the heart, and heart is only an Ashaya. So these quotations, n number of quotations can be very well seen in our science to correlate that there is very much relationship in between mind and Hridaya. And in Sushruta Samhita itself, there is a quoting saying that Hridaya Bhikada, that means the traumatic heart injury, can create apasmara, unmada, pralaba, and buddhinasha. Why can an organ, if it is just an organ, why can an organ create such a problem for this manas? Apasmara, unmada, pralaba, and buddhinasha can be correlated with manas, manorogas, but still a traumatic heart injury can create such problems. So here is the significance of Ayurveda. Because if you see, if you do dhara for a patient, Shiro-dhara for a patient with appropriate oil, definitely that dhara is supposed to be very good for relaxation. It will relieve the anxiety. It is good for hypertension. It will improve the circulation of all hormones, chemical balance, and even electrical impulses also. There's a lot of electrical impulses happening. That is the reason why the heart is beating. So even those things, tachycardia, bradycardia, all these things can be definitely regulated with dhara also. So this is one of the tools by which we can treat that heart diseases through Ayurveda. Now, I would like to go through a few cases which have got substantial relief with Ayurvedic treatment. This is actually Mr. Yadavalli Shivarama Shastri. He is a senior advocate of Hyderabad High Court, and he is aged 75 years, and his problem was recurrent angina, and he had hypertension, type 2 diabetes mellitus, and prostatomegaly. He was a non-case coronary artery disease. When he came here, his problem was osteoarthritis of the both knees also. And of course, according to the care hospital, they have advised to go for bypass surgery. This was the history when that patient came to us. So we told them that we are just doing certain things. It is not a substitute treatment for that bypass surgery, but still in Ayurveda, we have got something to do for the cardiac protection. As such, our usual combination of giving such a patient coronary artery disease is Gulgutiktan Kashayam, Yendugantam Kashayam, and Hridayaranava. This morning and evening we used to give. And Gulgulu Panchavaram Churnam, it works as a, I'm not telling that word, it can be it can be correlated with statin also because it has got Srodha property. It has got the property of reaching those to the target cells. And third is for Vatanulomia, we are giving Dasamur Haridagi Legium. Haridagi is supposed to be one of the rasayana which can do wonders on heart diseases. So this was the line of treatment what we have given for such a patient. And of course, for the treatment, Thailadhara, as I mentioned to you earlier, was given with Shuddhabala Thailam. And Pilchil, Pilchil means it is the Sarvanga Dhara with oil. And that was done with Kotanchukadi and Pintadailam. After 7 days of Thailadhara and Pilchil, we have done Podikiri, that means Churna Pindasweda. And of course, Upanaha was done for the knees. And Uru Piju with Mahanarayana Thailam. That is very important. That was done in addition to those treatments because Uru Piju is supposed to be, or it is found to be, very effective for most of the coronary artery disease. And of course, as a purificatory therapy, as a Shodhana therapy, we have done Madhudairigavasti also. And he was discharged, and 2 months of medicines were given to him at the time of discharge. You can see in his autobiography, he has written a book called The Story of My Life. In that autobiography by Mr. Yadavalli Sivarama Shastri, senior advocate, he has written that he was suggested for bypass surgery and he came to Kottakkal Ayurveda nursing home. I was advised to come as an outpatient. When I accordingly went there, I was advised to get myself admitted. After treatment there for a fortnight, I was discharged on 16 so-and-so and asked to continue the same treatment for another 2 more months. On my this line is very important. On my return from the nursing home at Kottakkal, my cardiologist examined me and said that the cardiogram was almost near normal, and this has strengthened my belief in heart diseases. So you see, such a problem which has got triple vessel disease, 3 blocks in each block in each heart cardiac arteries. So such a problem has been reversed only with the treatment of 2 weeks. So this gives us more confidence in treating such cases. At the same time, please don't take it for granted that all the coronary artery disease can be treated because it's a combination of so many other reasons also. But of course, this gives a good light for us to how to treat coronary artery disease. Second patient. Yeah, this is another patient. She was from Australia. When she came here, she was 59 years. She had severe complaint of left internal mammary artery and LAD and her occlusion in the saphenous vein grafts. Her complaints were unbearable recurrent chest pain many times a day, despite using glyceryl trinitrate transdermal patch. That means to reduce the patch, when she came here, the pain was 10 out of 10 in a pain scale. So to reduce that, she was using a transdermal patch to alleviate the pain. So even with that pain, she had severe pain. Even with that patch, she had severe pain. And with this pain, she was not having proper sleep. She had other complaints like multi-joint pain, arthritis, and pedal edema also. She was a type 2 diabetes patient, insulin dependent. She used to take 8 units 4 times a day per day. And she had hypertension and bronchial asthma also. Before this problem, she had CABG 2012. And again, once that occlusion started, she came to Ayurveda for better recovery. But she did not want to go for another one more surgery. Again, the same combination was given to the same patient. Gulgulistan Kashayam, Indugantan Kashayam, and Hridayaravarasam, and Gulgulu Panchavara Churnam 5 grams 2 times a day. In this case, that patient had asthma So instead of Desamula hierarchy, we have given Agastya Rasayanam 10 grams with Mahadhanandram Guliga 2 numbers. So almost the same line of treatment was carried out. And of course, Thailadhara was done with Shuddhavara Thailam and Abhyangam was done. Uro Piju was repeated for the same patient, and cold pack, that's a special treatment. For example, if the patient is having some occlusion, if you do some cold pack and hot pack intermittently, that would be able, like how we give treatment for plantar fasciitis. We dip our leg in hot water for some time, cold water for some time. Like that, if you do that recurrently, repeatedly, definitely there is a chance that the blood may flow a little more easier, and that may alleviate the symptoms. In that way, we have done cold pack means normal water, not frigid water, normal water and hot water. These two things were done alternatively. So these were the treatment done. And the other important procedure what we have administered is liquid diet fasting. Liquid diet fasting means, can somebody go and see whether my sound is audible? Liquid diet fasting is, we know that um, this is out of, this is a metabolic problem. This is out of bad cholesterol and all the other biotoxins. So our body enzyme have got such a power to digest all these metabolic toxins and bad cholesterol if you do fasting. In such a way, if we take the liquid diet only without taking any solid food or oily or cooked food, that over a period of time, if you do it repeatedly, that has got all the possible way of reducing the existing cholesterol or biotoxins. So in that way, that patient was ready to take liquid diet every 2 hours, one or the other fruit juices only. And after particular days, 5 days or 7 days, we can slowly shift to Desamulam diet. Desamulam diet means the diet which is cooked in Desamulam. Anyway, we are cooking in water. That water can be definitely made with Desamulam because you boil the Desamulam, and this boiled Desamulam paniyam can be used for cooking the other rice or puttu or chapati or whatever is there. So this procedure is very good for giving a patient during the treatment time. That can be, we call it diet as a medicine and medicine as diet also. In that way, this diet complement as a medicine. And after, at the time of discharge, even without that transdermal patch, that patient angina, that chest pain has reduced to 90%, and that pain scale have reduced from 10 to 1, and have fortunately and miraculously, her diabetes also became controlled, and all the insulin she has stopped. From 888, she has stopped that insulin. And of course, as the pain reduced, she could sleep better. And all the multi-joint pain were also reduced. So this is another good example how our treatment protocol can do such wonders in treating such patients. And I would like now, I should tell you, this patient is, even now that patient is coming here, but now her main problem is arthritis only, not the heart problem at all. Now we are not treating that patient for the heart problem. We are treating for arthritis problem. That means such a problem who was suggested for repeated surgery and who was using that transdermal patch since so many years for the pain, and that patient has stopped all those things, and she could get survived from that surgery, and now she is repeating her treatment for some other purpose. Okay, these are certain observations. Don't take it as some claims. Okay. And third patient, this is also a case of triple vessel disease, 62 years male, and chief complaints were exertional dyspnea. Even if the patient walks for 10 minutes, that patient was not able to walk properly. That patient used to get some breathlessness, heaviness of chest, pain in the knee joints, fatigue. And he had associated complaints of coronary artery disease, same type 2 diabetes mellitus, hemorrhoids also. And from the hospital, modern hospital, he was advised for CABG. And here, this is the report. Advised case of CABG with OCT guided PCI. We have given in this case Varanadiquasam tablet instead of Gulgulitham and Indugatam. Here there is a history. Our chief physician, Dr. P.M. Varia sir, have got a few cases successfully treated for carotid artery stenosis or carotid artery occlusion. So he has treated that occlusion with Varanadi Kashayam and Gulugulu Panchavaram Churnam. Taking that result as an inspiration, we have given this case Varanadi Kwatham tablet, 3 tablets 2 times a day, and along with Hridayarnavarasam, of course, all the other cases there was Hridayarnavarasam, and Gulgulu Panchavara Churna, a Sroto Shodhana medicines, and Desamula Haridigi Leha for Vadan Lomia medicine. And this Desamula Haridigi, in other words, and Agastya Rasayanam also, in other words, have a property to reduce the load of the organs. The cardiac load can be reduced, the liver load can be reduced, the kidney load can be reduced by giving this Desamula Haridigi Lehim. So this is a good medicine to reduce the internal organs load. Though we say Vada and Lomia, this Vada and Lomia have got a lot of things to interpret with. So this patient, after doing Dhanyamradhara, Pirichil, and Podikiri, and Muringela, Muringela is nothing but drumstick leaves, and Upanaham. He also wonderfully recovered at the time of discharge. His exertional dyspnea recovered 80%, and heaviness of the chest cured, and pain in the knee joints. Okay, this is not related to cardiology, still just mention that cell. And fatigue was other thing that also subsided. And one more case I would like to mention here. This patient is 80 years old male. He is from USA. He had bradycardia. Pulse is going down below 40. All the other 3 cases I was just telling only about coronary artery disease. Here, in this case, I got all the other complications of the heart. For example, if you see, triple bypass surgery was done in 1999. And again, 3 times he has done the angioplasty, and total 7 stents were put. And the artificial aortic valve replacement was done. Inguinal hernia, this is not related to this. And he is still taking that clopidogrel and amlodipine, all those statin, all those things. And at this stage, the problem is that patient's pulse rate is going down below 40, and head tremor, whenever that comes down, he is not able to walk properly, imbalance, and fatigue. And so all these things came after that artificial aortic valve replacement. So he came in such a way. We have given him Gulgulita Kashaya and Indugandhan Kashayam, Hridayarnavarasam, and Hinguvajadi Churnam, and we have added one more powder for Hinguvajadi Churnam because that is good for good metabolic medicine. It will create better metabolism. And Dadimadi Kridam, don't hesitate to give any ghee for a patient who is having cardiac disease if it is found to be Vadiga and Paitika. We can definitely give Dadimadi Kridam, and Hriday Raksha Kashaya and Dhanvantari Guliga was given at bedtime because night time he should sleep properly. That entire throughout the course of treatment, that patient was done with Thailadhara and Pirichil. And he has repeated the same medicines for 2 months. And I asked him what is the condition now. And this is the recent reply he has written. It has been more than 6 months I have communicated with you. Okay. After treatment from Kottakkal in April 2023 and taking medicines for my heart problem till September 2023, things were moving a little right direction. These were the medicines. After taking the above for more than 6 months, I was feeling okay. Not much uneasiness in the chest while walking, pulse variation also reduced. So what he did, unfortunately, is he stopped all these medicine for 6 months. Now, suddenly in the last few days, again, his symptoms improved. And I know that if you go to a cardiologist, he will definitely say that aorta, this pacemaker should be kept. But due to these multiple surgeries, I am a little fearful of going for that surgery. And I don't know whether it would be my last surgery. That was his remarks. And during last 20 years, heart has gone through a lot of trauma. So he has written his history in such a way. And God willing, with your treatment for almost 2 years, starting from August 2022, pulse variation got reduced, life was getting normal. So why I am telling this mail to me, revealing this mail is because we can also do something to regulate the heartbeat. Even that, when he was talking to me personally, telling that Dadimadi Krida have got a little wonder. Because if he take that Dadimadi Krida, his pulse is getting regulated. And the other thing is, in Dadima, one of the indication of Dadimadi Krida is Hridroga. Okay. Now, our question is, can the heart block be reversed? I think due to limited time, I will go through this presentation a little fast. Before these a few slogas will depend at the end of the, I'm basically targeting this presentation to the young budding doctors because they should have that confidence to treat cardiac diseases also. Because all the experts, Gurujis are very expert. I need not go through all these technical or theoretical aspect, but please go through this theoretical, just glance this theoretical aspect what we have studied earlier. That will give us a confidence that how we can treat cardiac diseases. This whatever I have told is practice. Now let me with the next few slides, let me tell you a few theoretical aspects also. It is the absolute essence of Sonada and Kapha. Absolute essence. That means it is the Sara of Sonada and Kapha. And where the heart is being placed. And what is the shape of the heart. Everything our Acharyas knew. Of course, I am not repeating. And how these doshas can be correlated with the heart. That also has been clearly told by our acharyas. So when we treat about the pranavruta vata, pranavruta kapha and all, we can take these things into as our account and treat such patients. And see, this sloga is very important. Vyanena rasatadurhi vikshevojita karmana. Here, the important dhatu involved is what? Rasatadu. And Yugapat Sarvado, the Rasatadu is spreading that ojas to each and every part of the body due to that Vyana. That ojas is the root cause of our stamina, vitality, immunity, resistance, everything, and so on. So here that Rasatadu should be taken into account. Don't forget, I am telling you about the preventive cardiology. Please note that Rasatadu. See, here the disease is doshayitva rasam doshaha. So this rasadhatu is getting vitiated and that is approaching the heart and it is making so many complaints. Again, don't forget about the dhatu, rasadhatu. Here what I would like to tell you is, you can see what is the nidana of ama. Ushmano alpabalattvena dhatu madhyam abhajidam dushtam amasegadam rasam. That rasa mamam prajakshate. That rasa, that is the rasa which is been told here. So that dushta mamasegadam rasam, if we are not creating such a environment for the body, for entering that rasa, dushtam rasa to that heart, no cardiac disease will happen. So you have to start our preventive cardiology from the ama aspect. We have to start our preventive cardiology from that alpakni aspect. And that Lena Kapha aspect, Lena Dhadu aspect. So this is our basic concept. That's why I am stressing this word, Dasa. Again, here we can see a lot of coincidence of metabolic disease. Guru Sividam Adisnigdam Adimatram Samasnadam. This is the cause for Rasavaha Srodo Dushti. Dasavahini Dushyanti. So can't you just correlate that metabolic disorders, the cause of metabolic disorders with that Guru, Shidam, Adisnigdham, Adimatram, and Asnadam. So this is the cause for metabolic disorders. What are the metabolic disorders? Hypertension, sugar, that is blood sugar, and low HDL, high LDL, obesity. These are the 5 basic metabolic disorders. All these 5 basic metabolic disorders will ultimately end up in the cardiac disease. So here rasa should be taken care. Here our acharyas have told one more thing, Chindyanam cha adisevanal. This reference you cannot see in any other modern science. So that stress is also one of the main important. Here again, Ayurveda can contribute a lot of things for preventing the cardiology. And of course, in Dasakshaya Lakshana, we can see Hridroga, we can see breathlessness, exertional dyspnea. Again, the involvement of rasa is very, very important. And when we come to the, I'll just go through a glance through this thing. Vega Udirna and Dharana. Most of the people, due to their immediate, their work structure or any other thing, Vega they are not worried about. So we have to educate the people to take much care about the Vega, Udirna and Dharana and Asatmi Bhojana. Excessive intake of Kashaya and Tiktarasa, Pathya is very important. Adivyayama is very important. And Shodhana Adiyogam, excessive administration of Shodhana therapy. Generally, we forget all these things. Abhigadam, trauma, and Amasandharanam, untreating the biotoxins. Again, that is a very important thing because rejuvenative treatment is nothing but treating the biotoxins. In such a way, most of the cardiac diseases can be treated by regular cleansing of the system. And of course, Chinta, Shokam, Bhayam, Trasam, etc. Gulma Nidan, all the Nidanas of Gulma are told to be the Nidanas of Krudroga also, and Gata Nidana also. And when we say the Vega Dharana in particular, Athovada, there is particular reference that it can create Hridayaghadam, Sakr, Hridayasya Uparodham, Udgara, Vibantho Hridayorasaha, Krishna, Hridgadam, Bashpam, Hridruk, Vami, Hridlasam, Shukla, Hridvyatha. So there is a direct indication that all these Vega Dharanas can create Hridayasya Uparodha. And Shuddha Chikitsa, after improper Snehana and Svedana, that generally in our clinical practice we may forget because proper Snehana and Svedana is required before doing Shuddha Chikitsa. And holding the Samadosha, improper food after Vamana and Virajana. So Peyadikrama, most of the people due to time constraint, they forget about Peyadikrama. Please don't do that. Peyadikrama is also equally important after doing Virajana Karma and Shodhana Karma. And the important diseases which can be directly correlated with heart diseases are Gulma, Udavarta, and Sthaulya. And the conditions we can Purisha Kshaya, Gulma, Vidradhi, Puriksha Kshaya, that's a very important thing. And Vadajuram, Kaphajuram, Kasam, Shwasam, Rajayakshma, Chardi, Pandu, Udaram, Madathyam, Arshas, Arishtam, Grahani, and Prameha. So what I mean to say is what we see generally, this atherosclerosis or triple vessel disease or coronary artery disease, this is not the only heart disease. There are so many other diseases also which can affect the heart. For example, children can have heart disease. So the symptoms they have clearly told. I'm not telling that this is the end of all the symptoms, but they had some idea about what will be the condition if the heart has been had some problem. Vevadur, Vestambha, Pramoha, Junida Dravaha. Heart disease for children. Here, the kaphakshiram, that mother's milk is very important. Ultimately, what we have to understand is when we treat about a cardiac disease, we have to go for rasadhadu dushti, ama, and this principle is also very, very important. There is no other heart disease other than this adipravarti, sangam, siranam grantha, and vimargamana. Dear student, once again, there is no heart disease other than this adipravarti, sangam, siranam grandhi, or vimargamana. So everything can be correlated with any of the system, any of these pathology, and we can treat it very well. And here, there will be some doubt for somebody how Thailam can work. There is a beautiful sloga from Gunadipika. So the Srodas are getting constricted. Srodas Sangoji Eda. When the Srodas are getting constricted, here Teshu Praveshtum उसमें जाने के लिए सरदा सौक्ष्म्य स्निग्धत्व मार्दवैहि. Due to that quality of saukshmya, sukshmata and snigdhatva in Mardava, Thailam Kshamam, Thailam is capable. For what? Again, you see, Rasam Nedum, to carry the rasa which has got good quality. Krishanam Tena Brahmanam. Don't worry that it is good for both the patients, for Krisha and Brahmana patients also. It has got additional qualities of Vyavai, Sukshma, Tikshna, Ushna, Saratvam, and Mardavam. Sanai Pragrute Thailam. So it has got the property to improve the vascularity. That is what the Thailam indicates. So definitely we can give appropriate Thaila internally and externally for any cardiac diseases. And of course, Panchakarma, most of the Panchakarmas are restricted for heart diseases only due to the fear of risk. But still, there are certain smaller versions like Snehavasti, Pradimarsanasya, and Nitya all those things can be definitely done for heart diseases. And of course, for any diseases, there will be two categories of treatment. Our treatment is very simple. Either we have to give Sandarpana or Apatarpana treatment. So Deeptek knows Sandravayami, Hrudroge, Vatgi Hidam. Here we have to give Sandarpana treatment. Kshiram, Dadi, Guda, Sarpi, Audagam, Anugam, Amisham. So if we are confirmed that it is a Vadika Hridroga. We can definitely give all these things. But there are other four Hridrogas, Paitiga, Kapaja, Hanibadika, and Krimija. In all those things, in addition to that, wherever there is a Vadika Hridroga with Samba, Jadya, Ama, in those conditions, Dukshanam Acharya, we have to do Lankana Chikitsa. So Acharya have got no doubt about doing that. So we have to do Lankana Chikitsa and Santrapana Chikitsa appropriately. I will tell you a few. I'll go through a few formulations which are very commonly used for heart diseases. One is Chirabra Thailam. So in that right side, there is a clear indication that it can be used in heart diseases. Dhanvantaram Thailam and Narayana Thailam, it is particularly told that Hrutshulam, Parsashulam, Maharaja Prasarani. For referred pain, Maharaja Prasarani is supposed to be very good actually. For example, if there is a transferring pain, Intugantam is supposed to be very good. Dadimadhikritam, Chiddham, Hrit Pandu Gulmarsaha, Tiktankritam, Hridrogam, Varanadhikritam, and Sarvamayandakritam, Hrutshulam. These are the keys. Of course, Urovasti, Piju, and Vestanam. That is supposed to be good. I told you one case of Australia. She had that recurrent angina. Even after going home, she used to do Uro Piju. That Urovasti is not practical, but at home, what we can do is Uro Piju we can do with the help of some person. If nobody is available, we can definitely do Vestanam also, Uro Vestanam also. So Mahanarayana Taila, according to me, that would be appropriate. Pilchil and appropriate Murdu Virajana should be done with Avipatti Churnam or Trivarlehyam. Sorry. Yeah, Kashayam. If it seems that it is Ama, Amurdotran Kashayam, Ardhavilya, if there is Shobha and other pathology, you can use either Ardhavilyam or Punanavadi. It can reduce that cardiac load. Kalasakadi Kashayam is supposed to be, or seems to be, or found to be, experienced to be good for hypertension. Ashtavargam is good for all the other associated problems. Indugandam Kashayam, Gandharvasadi Kashayam, Balajiragadi, Vidaryadi are good. Trayantyadi Kashayam, it is particularly mentioned in Hridrogam also. Desamula Kadutrayadi, for the pain, acute pain, it is very good. Nayopayam is good for exertional dyspnea. Padola Muladi is good for Hrid Vastishulam. Saptasaram is good for Hrid Rogam. And when we go to the Guliga, Dhanvantaram Guliga, Valiya Marma Guliga, Sarva Marma Vigarajil, Hridaya is one of the Marma. And Sarpagandhadi is supposed to be good for hypertension and anxiety because the Sarpagandhadi has been ground in Somalada Sarasa, so it should be very good for anxiety also because for most of the cases, anxiety is the root cause for hypertension. And Hinguadi Guliga, Hritshula and Hridgraham. When we go to the Arishtam, Abhayarishtam, Chandanasvam, Vidaryadhyasvam, Vidaryadi Ganam is supposed to be Hridyam. Hridyam we can interpret it in so many ways. Parthadhyarishtam, Lohasavam, and Karpuradi Thairam is supposed to be very good for Hridroga. So why I am telling you these many medicines is because we are not using the maximum potential of these medicines. That's right. Salisavattradi Churnam, Navayasam Churnam, Yavanyadi Churnam, Hingvajadi Churnam. And in Bhasma, Annabhedi Siddharam, Kalyanak Pravala Bhasma, wherever that muscle tone is lacking, in such condition, Pravala Bhasma can be given. That is cardiac myopathy, cardiomyopathy. We can give Pravala Bhasma, Siddhamagaradhujam, and Prabhakara Vadi can be given. And in Lehyam, of course, Agastya Rasayana, Talisavatradi, Gandhi Haridigi, Mahavilyadi Lehyam can be given. And I'll go through some single drugs which are very effective in cardiac protection. One is Lesuna. It is supposed to be anti-atherogenic, anti-atherosclerotic, lipid lowering, and anti-thrombotic, anti-hypertensive. The mode of administration is Lesunatshira. Then Arjuna, protection against anti-oxidative stress, lipid lowering, anti-thrombotic, anti-hypertensive, cardiotonic. And Sthira, it can also be given as a Sthira Payaha. It will protect the heart from oxidative stress, cardiotonic. And Haridagi, so many formulations like Agastya Rasayana, Dasamula Haridagi, Kamsa Haridagi, Gomutra Haridagi, all these things. Haridagi is one of the main ingredient. Protection against oxidative stress, lipid lowering, and Guluji is supposed to be a Rasayana, protection against the oxidative stress, lipid lowering, and anti-arrhythmic. Ashwagandha, protection against oxidative stress, lipid lowering, antihypertensive, cardiotonic. Apart from all these things, it's a very good stress reliever. It's a very good antihypertensive medicine also. And you see, Gomutra. Gomutra is supposed to be, when we say about the statin, I told you some complications in the initial stage. It can create, uh, statin-induced myopathy, neuropathy, and brain degenerative diseases. So many things. Even net it is available. I'm not telling from my side. But in such a case, our attempt in future should be, how can we create a medicine? How can we make a medicine which can give the patient relief like a statin, an Ayurvedic statin, so without giving any side effects. So such way we have to think. Statin means, just for the knowledge of new generation I am telling. So it has got so many other properties, like it is rasayana, and it has srodoshodhana, and it has got lipid lowering capacity. It will improve the immunity, and it's a good blood thinner also. Gomutra. So we have got so many other drugs like Mandura Vadaga is there, Pathyadi Churnam is there, and Punamnava Manduram is there. There are so many combinations which contain Gomutra. These things can be definitely given. And of course, this sloga is very good. If we attempt all the yogas medically, and if you do all the karmavi panchavischabi, if you go through all the panchakarma, if you all go through all the this thing, rasayana, like shilajadu prayogatu, rasayana manyeshal, prayogal hema uttamaha. Hema is supposed to be best for treating such cases where all the other conventional treatments fails. That's what this sloga indicates. It is from Brihat Rasaraja Sundaram. We have got so many medicines which have got gold as a main ingredient. For example, Suvarna Muktadi Gulika is there, Gorojinadi Gulika is there, some Bhasmas are there, Siddha Magaradhajam, Swarna Bhasma itself is there. But please make sure that that condition is appropriate for giving that gold. So in that case, gold can give a lot of things. When I was going through some research papers, gold nanoparticles is proved to be one of the most promising strategies due to its accurate delivery ability to the target tissues of heart diseases. So this is the crux of the thing I got from our research papers, how gold is useful in. So we have got so many medicines which are in which gold is one of the important ingredient. Now, I just mentioned to you earlier, diet is either medicine. It can be given as a medicine also. So liquid diet fasting can be definitely tried in cardiac diseases. If the patient is having bala, that should be very important. That is very important. That patient should be having manobala, deha bala, and sattva bala also. In that case, definitely we can give this liquid diet fasting. And we need not tell you again significance of vyayama. There are particular treatments stored in kapha, pitta, and vata. But vyayama is indicated for all the sanibadika, kapha, pitta, and vata. This is the conclusion of my presentation. And with this, I end this presentation. I think I have not taken much time. Initially, there was some technical issues. I could not just enter in my computer, but I had to shift my place to some other place. That's why this program went on well. I think you could hear properly. You could see me properly. With this, I conclude my presentation. I pay my gratitude to all the Gurujans, all the Shishyas for a patient hearing. And thank you so much for giving me this opportunity. Over to Pooja.
Thank you so much, sir, for a wonderful presentation and sharing your knowledge with all the Ayurveda community out here. I think now I would like to request anybody in this session who has any doubts to either post it in the chat box or ask their doubts. Any doubts you can clarify?
Hello. Good
Hello,
evening,
sir.
sir. Rajagopal, sir. Good evening.
Yes.
Very
Good evening.
excellent presentation, and your experience is very much useful to the Shishyas and the faculty as well, Gurus as
Thank
well.
you. Thank you so much.
Sir, just I wanted to know the any treatment Just you said Pravalabhasma will be useful in myopathy. See, any other really effective in myopathic disorders?
I think in myopathic disorder, Dhannundaram Kashayam is supposed to be very good actually. Dhannundaram Kashayam and Prabhakaravati and Pravala Bhasma.
Dhanvantar Kasayam Prabhakaravati.
Yeah, this actually you can just imagine. For example, there is a case of Sutika. In the Sutika, what is happening? The Sutika, the muscle, the tone up of the muscle is being relaxed after the delivery. To regain the tonicity, what we are generally giving is Dhanvantaram Kashayam. Dhanvantaram Kashayam with avartis and some ghees, Dadimadi Krita or some other ghees, or Dhanvantaram Kritam. So in such a way, the principle is same. Wherever there is a lack of tonicity, we have to consider it as what is that a little more towards Vatika. And wherever there is a little rigidity from the investigations, now we can understand what is the pathology of the disease. Even though it is muscular, whether it is due to cardiac constriction, muscle constriction, or is it due to some relaxation. So these are the two aspects. So in the other way, we have to do something to open up the rigidity. In that case, Gomutra, the things which contains Gomutra would be a better choice. For example, if the muscles are hardened, in such condition, the things which have got some property to have the Srodoshodhana and which have got some property to penetrate into the deeper tissues, that would be better. In such case, Gomutra is one of the choice. And the preparations like Gulgulu added preparations, for example, Tribhala Gulgulu, Kanchanara Gugulu, such medicines can be Kaishora Gugulu. Kaishora Gugulu, Nityam, if you give regularly, it is told that it is Rasayana. That is one of the important medicine which can be given regularly. Even in Sloga, it is told that Nityam, if you give it regularly, it makes the body, it gives the body Rasayana property. So in such a way, those medicines can be given if the muscles are consolidated. If the muscles are relaxed, we can definitely give this thing, like ghee and avarti, such kind of things. But observe the patient. Don't think that you have to. If the patient is taking some modern medicines parallelly, don't tell the patients to stop any of the modern medicines. That medicine should be taken in parallel with whatever medicines you are giving. Because due to overconfidence, as I told you as an example, that fourth case, due to over confidence, that patient stopped the Ayurvedic medicine, and after stopping again that patient's bradycardia is increasing. So that is not a good sign.
Thank you. Thank you so much, sir.
Thank you so much.
So there is a question in the chat box which says that in the third and fourth cases, Preachel has been mentioned as one of the treatment. Which medicated oil has been used?
Yeah. What was the question?
In the third and fourth cases presented by you, Preachel is one of the treatments. So which medicated oil has been used for the treatment?
Actually, any medicated oil can be used, but generally for heart, either Dhanvantaram Thailam or Mahanarayana Thailam would be appropriate. But why we have used Kotanjukadi and Pintadailam is because that patient had osteoarthritis. So that was the reason why we chose that particular oil. Otherwise, you can, if the patient is only, generally the thing what we generally see is cardiac patients alone as a symptom of heart, they don't approach to Ayurveda. They will tell cardiac problem as an associated problem. So in such problem, we have to consider the other diseases also in parallel. So that is the reason why, for that particular reason, Kotanjukadi and Pindailam was used. Actually, that feedback from the patient was, that report from the patient who wrote in his autobiography was very encouraging to many of the Ayurvedic physicians. What is the functioning of Pilchil? Actually, it's according to Ayurveda, it is Snehana and Swedana together. Snehana and Swedana together. What such kind of coronary artery disease requires is Snehana and Swedana together. In such a condition, this block is nothing but a biotoxin. Block is nothing but a cholesterol. So in that condition, that unwanted lipid should be melted first, And after melting, it should be slowly spread or circulated to the normal circulation. It's a time-taking process. I know that, but still our aim is to do that actually. So in that case, Snigdhata will melt that particular clot or melt that particular lipid, and that Svedana will try to bring back, reverse that particular block or particular lipid to the costa. So that is what we imagine from our mind. How much these things are going to happen, we don't know. In that way, spiritual is supposed to be the good thing. In parallel, if you do dhara, that can of course regulate the cardiac beat, pulse rate, everything. So that will make, in general, a good atmosphere for the body to prevent the heart disease.
So the next question is, in case of hypertension or tachycardia due to anxiety or stress, if this is the case, what is the treatment principle? Whether we will treat it based on Vataja Hridroga or we should consider it as ama and resolution.
Now, for treating, even though we are confirmed that it is Vataja Hridroga, please treat Amaja treatment first. Brimhyamstu Mrdulankhil, there is a quoting. Ayurveda says that Ayurveda Shastram tu Udaharana Matrameva. So without our knowledge, Acharyas have given us so many indications. In one indications, Acharya have told that Shastram tu Udaharana Matrameva. We are just telling some examples. From this, we have to develop. So in such conditions, some condition, they say that Brimhyamstu Mrdulankhil. Even though we are sure that Sandarpana treatment should be done, please start with Lankana Chikitsa for a better recovery for the Brahmana patients. So in that way, please start with Amaja treatment for any patients who are suffering from cardiac problem, because there in the present era, there will not be even a single patient who have got Kevala Vadiga Roga.
Thank you, sir. The next question is, after angioplasty, if a patient comes for Ayurvedic treatment, to further any other cardiac related abnormalities, what treatment can be done?
We can definitely, because the heart disease is not the ailment of the heart alone. It is the ailment of the entire circulation. So definitely avoiding that chest region, we can do all the other treatment. For example, Pilchil, Navarakiri, Podikiri, everything can be definitely done in such a patient who have cardiac diseases with other problems. But only thing is, as that patient is having some angioplasty, as the stent is there inside, please don't try to do any snehana and svedana on the heart region, chest region.
Next question is, what do we use if the ejection fraction is low?
The question is not clear.
What do we use as treatment in condition where the ejection fraction of the heart is low?
I think we have a patient who had a low ejection fraction. We have given Dadimadhikrita. Dadimadhikrita 15 to 20 ml early in the morning, avoiding the other breakfast as a snehapana in very small dose. We can definitely give 15 to 20 ml early in the morning, followed by some kind of liquid diet. It can be oats porridge or it can be even rice porridge. Don't take anything any other dosa, puri or other masalas, nothing. No other breakfast. That means this ghee is the breakfast. This ghee will spread the body in a better way if you don't take any breakfast. And before lunch and dinner, we can give some other Hridaya Raksha Kashaya or Nayopayam Kashaya or some appropriate Kashaya. But morning time taking this ghee is supposed to be good to improve the ejection factor.
Thank you, sir.
Thank you.
No questions in the chat box. Any other questions, or we wind up today's session? Before I conclude, on behalf of the organizing committee, I would like to thank Dr. K.V. Rajagopalan sir for sharing his views on this topic. Also, I would like to extend my sincere gratitude to our mentors, Padma Bhushan by Devendra Pragnaji, our director Vandana Siroha ma'am, for guiding us through all for the success of each event in this series. I would importantly like to express my heartfelt thanks to all the gurus, shishyas, and all scholars who, with their presence and active participation, have made this webinar a successful one. Last but not the least, I thank the RAV organizing team who worked behind the stage to make this a successful event. I would like to convey that the next session of Gyan Ganga will be on 20th June 2024. And celebrating the International Yoga Day, we'll have our Guru Vaid Achyut Tripathi ji throwing light on yoga and Ayurveda. So hope to see you all next Thursday. Till then, thank you so much. Shubhadinam. Namaste.
Thank you. Thank you. Where is that exit?